Good afternoon, everybody. Welcome to Wilmington Business Journal's BizTalk, our occasional live stream series interview program where we touch base with some of the headlines and newsmakers in the area, especially in between our in-person power breakfast events. Today, we wanted to update the Novant Health and New Hanover Regional Medical Center. It's been 2 years since the sale of that county-owned facility closed to Winston-Salem based Novant Health. So joining us today, we have Shelburne Stevens, who's president of Novant Health NHRMC, as well as president of Novant Health's coastal region, as well as John Gisdick, who is executive vice president and chief business development officer with Novant Health, and as many of you know, the former president and CEO of NHRMC. So two people who have been here throughout, not just the transition post-sale, but also in the time leading up to the sale of the facilities. So today we wanted to talk what it's been like these past 2 years, what issues and areas that they're continuing to look at as they move forward in the future, both with staffing and also new capital projects that are underway. And also to answer some of your questions as well, as we have this next 20 minutes to do another check-in on today's anniversary of that sale. So John and Shelburne, thank you for joining us today.
Thank you for having us, Vicki.
Thank you.
I guess we can just start broadly. I know we did this at the 1 year mark and we do check in periodically as this comes in, but Shelburne, if you want to kick us off and tell us, you know, what the bird's eye view of the past 2 years have been and where you guys are now in terms of that process.
Yeah, thank you. So we're in a good place today. I'm happy to report. We've spent a lot of time investing in our team members over the last 2 years, making sure that we can pay them competitive wages to keep them here in the market. So we've invested over $65 million just in our team members' salaries to make those competitive. Day one, we announced the living wage would go up to $15 an hour, and we just announced last week that we're going to increase that to $17 an hour for our team members. So those are two big impacts. For our community, just last year alone, we had over 13,000 patients that were impacted by our patient financial assistance program. And as a reminder, that increased from 200% of the federal poverty level to 300% of the federal poverty level for household income 2 years ago on February 1. So that's a significant amount of patients that do not get a bill from us for the care that they received. And then with our partnership with UNC, we've increased the number of residency programs here. We've applied to start a psychiatric residency program in the coming years, and then also increased access to pediatric specialty care so that parents and their children don't have to drive 2 or 3 hours to seek that specialty care.
And John, what are some of the biggest, I guess, questions you still get 2 years into the, I would say, merger process, but it's been 2 years now. That was a milestone mark as part of the purchase agreement as well. Some of the things were tied to that. What has your viewpoint been the past couple of years, and what are some of the things that have surprised you along the way?
Yeah, absolutely. You know, it is just remarkable to think about 2 years. And if you think back 2 years ago when we closed, it strikes me, and when you talk about surprises, one of the biggest surprises that I have over the past 2 years is just how quickly circumstances can change. 2 years ago, we were talking about entering this from a position of strength and controlling our own destiny. And Vicki, as you know, our industry has experienced unprecedented challenges in the past 2 years. That's the exact future that we talked about during the partnership exploration, really talking about the challenges and the headwinds that our industry was going to face. Unfortunately, those challenges came a lot sooner than any of us anticipated. And so really, I believe fortunate to be celebrating our second anniversary in partnership with Novant Health, especially given how tumultuous the past 2 years have been, and the fact that Novant Health has been there to invest hundreds of millions of dollars in our community. When you ask about questions, I'm not sure it's questions so much as confusion. A lot of folks, any merger's hard, and change is certainly very difficult, and you can never underestimate the impact of change. At the same time, trying to do a merger during a global pandemic creates even additional challenges. And, you know, one of the things that surprised me, and also I think an opportunity for us to learn from over the past couple of years, is those challenges that we have faced that are truly on a national scale. Our entire industry is experiencing those challenges, seem to be blamed on Novant Health. And somehow the change to Novant Health created those challenges versus understanding or recognizing that they're industry-wide challenges. And we're fortunate to be part of Novant Health to have the resources to respond to those challenges.
And of course, one of those major challenges that you're talking about industry-wide and we've talked about before is staffing, is nursing, is the support staff. I'm curious, how is there a way, is there a metric, is there a measurement? How can you tell if a certain area or if our area is being more severely impacted, particularly in terms of nursing shortages? How do you know when you look at comparable hospitals, whether we're faring better or worse in terms of navigating that shortage?
I would say when I talk to my peers, we're all pretty much in the same shape. Our reliance on travelers, not just nursing travelers, but other specialties, is still high, and I don't see that going away in the near future. We are working locally with schools about how do we grow the class size of not only nursing programs, but allied health programs. We've also been looking at our care models. How do we create new roles that could support nurses and respiratory therapists to still take care of our patients and deliver that high quality care and safe care that we focus on every day. John, anything you would add?
No, I mean, I think Shelburne's correct. And you know, Vicki, unfortunately, this is a nationwide nursing shortage and healthcare professional shortage. And so we continue to aggressively recruit and retain staff. We're trying to offer flexible scheduling, flexible benefits to not only attract, but retain. You know, we're looking at international staff and bringing in international nurses and other professions. So really trying to do everything we can to stabilize that staffing situation, but it is here for the long term. I mean, we've known this is coming in our industry for years. Demographics are only going to make this worse from the standpoint of more people getting older every day and all needing health care, and fewer people in the workforce, and especially in healthcare professions, to take care of all of us. And so I believe part of this, and we are heading down this path, is the need to really look at changing the care model. We can't just keep doing what we've always done from a staffing perspective and from a care model perspective. And so that certainly has to be part of the solution as well.
And kind of hand in hand with that is then also patient care and how it impacts that. So if you look at the past 2 years, how would you say, how would you classify how patient care is now in the local health system compared to before?
I think our patient care is in a better place today than where we were. We definitely felt some challenges last year with staffing, with some travel nurses leaving and even full-time nurses going to be travel nurses. I would round frequently and I would have a travel nurse here from Duke. And so we were even from within the state. So we've been able to recruit full-time nurses, as I said, and get some more travel nurses in here to keep those nurse to patient ratios down at a manageable level. And this last summer, we did have to block some beds for those ratios, but today we don't have any beds blocked, which we're proud of.
Yeah, and Vicki, safety and quality was one of the key tenets that the Partnership Advisory Group looked at and looked for in a partner. And Novant Health really shined in that regard. And they've brought a lot of tools to our organization, to New Hanover Regional Medical Center. When we look at VizAI, which is artificial intelligence to detect strokes sooner so that we can save those brain cells, we've been able to implement that. the Vizient Quality Database, which is a national database of some of the top healthcare systems in the country, that gives us visibility into safety and quality data that we never had before, real-time visibility. And so we can see the progress that we're making and really be able to impact safety and quality. I would also remind everybody that it's the same doctors that are caring for patients today as it was 2 years ago. We were always extremely proud of the phenomenal medical staff that we have here in the coast. And it's the same doctors and providers caring for our patients today. And so that same remarkable quality that we were known for before is still being delivered by those physicians. And, we've never been about the awards, but, we could really talk about a lot of awards that our organization received just in the past year alone. I mean, a couple I'll mention. Newsweek named New Hanover Regional Medical Center one of the best hospitals in the country for maternity care. It named our endoscopy center as one of the best ambulatory surgery centers in the country. And so, again, while we did have some challenges, as Shelburne mentioned, we can't lose sight of, really the remarkable care that's being provided here, as has always been.
I'll just add on to what John said. I mean, it is, the medical staff is still the same staff, but we've also been able to take some of those specialties throughout our region. For Brunswick Medical Center, we're using more technology around doing video visits with specialists. So we've been able to keep patients closer to their home at Brunswick and Pender and others so that they can receive that care there, and continue to look at how do we expand those services so people can come here to 17th Street for that higher level of care and really build our community hospitals going forward.
You're on mute.
And I want to talk about a little bit more about one of those staffing changes updates, though, that I know has received a lot of attention in the past week or so. But looking ahead towards continued staffing pressures and what it is that you might be expecting. Last week, Novant Health, the overall system, announced layoffs for resulting in affecting 50 employees, but this is out of Novant's 37,000 employees. It did not share how many of those were local. However, in part of talking about that announcement, they pointed to pressures such as the ongoing impacts of the pandemic and care models. So do you have any sense in terms of when we say, a scary word like layoffs and what employees might be thinking, what are you telling the coastal region employees here then about whether or not it's going to continue to get worse or not?
Yeah, no, thank you for that question. Healthcare is not immune to the difficult economic realities that many companies are facing across our country right now. And many health systems are facing just tremendous economic pressures. And Novant Health is not immune to that either. We saw announcements here in our own community with Encino and other companies that are having to make very difficult decisions. And, in 2022, for the first time in decades, Novant Health experienced an operating loss, as did many health systems across the country. And so throughout last year and into this year, we're certainly working to stabilize our financial situation and remain committed to delivering the remarkable care that our community deserves. But that did require us to make some very difficult decisions to eliminate some leadership positions across the entire organization. Some of those were here in the coast, but those impacted the entire organization across the entire state. We will continue to work on stabilizing our financial situation. We do not anticipate any further impact. Those decisions were really at the leadership level. Changes have to start with leadership, and we wanted to keep the impact as far away from our frontline caregiving staff as possible, so that while making those difficult decisions, it gives us the opportunity to really stabilize our financial situation and continue to invest in care for our community.
And one of those leaders, what locally was Dr. Philip Brown, which I know has elicited a strong response, or has elicited a response from after him being included in those layoffs, partly because his role previously had been chief physician executive before the sale, but after joining Novant, he became the chief community impact officer and was very visible in the community. I think there's some concern about what then happens in terms of community impact and some of those health equity goals and focuses that I know fell under him. So is there anything you want to say to address to that?
Absolutely. So our commitment at Novant Health to diversity, equity, and inclusion, to community engagement, absolutely has not and will not waver. That is a hallmark that Hanover Regional Medical Center was certainly proud of, engaging our community and really making strides in addressing health equity and the social determinants that impact care. The work with the Michael Jordan Family Medicine Clinics continues, and we look forward to opening our first one later this year. And so again, while the contributions of Dr. Brown and many others that were impacted by these difficult decisions will certainly be missed, our commitment to those areas and to those focuses does not change.
I'll throw this out there. I don't know if you're able to comment on it specifically, but are you able to speak to why Dr. Brown was included in the leadership changes?
So I cannot speak to that specifically. We did have to look across our entire system and make difficult decisions at all levels of leadership in all areas across the company. And unfortunately, Dr. Brown was part of that.
Okay, and before we run out of time, I do want to make sure we have some time to speak of some major capital projects that are going on and updates on some of those that are coming in the future as well. The Neurosciences Institute recently opened. That's a tower on the 17th campus. I think has gone through many different original intentions for what it would be used for, orthopedic at one point. But what is the, I guess, focus of this Neuroscience Institute? How large is it? And why did you guys decide to focus on that particular specialty?
So I'll take that one. Yeah, today is day one of that tower opening up. It's a 108-bed facility focused on neuro patients who might have had stroke care or other neurological issues. We will have our level 3 epilepsy center there. We have ORs that are specifically in procedure rooms dedicated to neurosurgery there. There's a neuro ICU that's on those units there, but it's really dedicated to cohorting those neurological patients together so that we can provide that top care that we've always done here, and continue to serve the region.
Is that an area where you see continuing, not neuro, but in terms of building out these more specialties and attracting additional specialists here? Is that just strategically an area you see more investment coming in as part of when we talk about the changing model of care? Is that part of the long-term strategy, or is that just an area that Novant and NHRMC had wanted to add to more locally?
No, I think it's growing all of our specialty care going forward, not just neurosciences. But as I said earlier, trying to keep patients local into their community hospitals with Brunswick and Pender, and then the future Scotts Hill Hospital, so that they don't have to come here at 17th Street. And we can leave these beds for the region for that higher level of care that patients need in the region, and really push out sort of the lower level care to those community hospitals.
What is the latest on that new hospital to be built in Scotts Hill in northern New Hanover County?
So we're in the final stages right now of design with that, and hope to get those design documents back soon. We are going to be breaking ground soon on a new medical office building there to grow providers for that region. We need the providers there first, and then we'll begin construction on the facility. We have seen some delays and are hearing of possible delays just for the industry of construction and some of those things, but planning and moving ahead with that facility.
Yeah, Vicki, and I think it's, Shelburne's talking about all the exciting growth opportunities and all the investment that is occurring in our market, which again was certainly one of the major reasons for pursuing a partnership. And again, just to provide some context around that, Shelburne just rattled off several $100 million worth of capital projects that are moving forward that would absolutely not be happening today if New Hanover Regional Medical Center was independent standalone. When you look at our maximum debt capacity historically, it was around $200 million, and that was pre-pandemic in our best financial years ever. And so we would not have been able to get the bonds or the debt to build these projects today. And they're much needed by our community. We know how much our community is growing from a population standpoint and needs that care. And so again, when we think about the realities of our partnership and the situation in healthcare and in our industry right now, again, we're extremely fortunate that Novant Health continues to make these investments in our community, investments we would not be able to make on our own.
Vicki, a few others that we have is the ambulatory surgery center we're building over in Leland to open up next year. We have a brand new medical office building down at Brunswick Medical Center that will open up later this spring, early summer, so we can expand those specialty services. And as John mentioned earlier, the Michael Jordan clinics, we're really excited about getting that first one open this year. So a lot of investment here in the community.
So you mentioned several projects coming up. Besides those, anything else in terms of the third year post sale that you expect to be spending a lot of your focus or attention to?
It's really focusing on safety and quality and providing that high level of care. And as we mentioned, just looking at the different care models, since there's not enough workforce out there, how do we do things differently to continue to take care of our community?
Okay, well, thank you very much for joining us, and thanks everybody for tuning in. If you missed the beginning or you're catching up later, we'll also have this linked in our afternoon email this afternoon and on WilmingtonBiz.com. So thank you very much, and we'll keep you posted on our next interview as well.